And where is Dr. Fauci?
I don't know, but every time you ask that question, whenever he's not here, you look, you say, where is he? And you'll say, is there a problem? No problem whatsoever. Every time he's not here, sometimes I'll ask him to come because that's the first question that you and a couple of others from the fake news establishment ask is, where's Dr. Fauci? We're doing great together.
Different subject, if I may
Except
ask.
we're covering a different subject today. Go ahead.
Different subject, if I
Go ahead,
may
Jim.
ask.
Try another
Mr.
one.
President, you have said areas are if you were preparing for a pandemic, if this government were preparing for a pandemic, why is it we don't have enough masks? Why is it we don't have enough medical equipment in this
Previous
country?
administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it. You know the answer. The previous administration, the shelves were empty. The shelves were empty. So what you should do is speak to the people from the previous administration, Jim, and ask them that question. Because the shelves were empty. And you know what else? The military shelves were also empty. We had no ammunition, literally. And that was said by one of your favorite generals. We have no ammunition. Guess what? We had very little medical supply also. All right. Go ahead. We'll get it back. We'll get you back. We'll get you back, please.
What about that question?
Jim, I said we'll get you back. Please, go ahead. Our people have done an incredible job. Most people have said now, and I said this yesterday, governors have said, thank you very much, great job, if they're a Democrat governor. In some cases, not in all cases at all. If I said, here's 1,000 ventilators, how many do you want? We want 1,000. Here's 1,000. You got them. But you know what we're going to do? We're going to add another 5,000. Is that good? They said, wow, that's great. And then if Jim Acosta goes and says, are you happy with the president? No, he should have given us 10,000. That's what's happening. You know why? Because that's a standard political answer. And that's a shame because we have done a job like nobody's ever done a job. But we've just delivered a lot of masks. We've just delivered a lot of gowns and protective gear. But you know, you're talking about a massive number. But as of this morning, people were very, very happy.
Thank you. Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
Oh, what are you asking?
And
I mean,
even the fact that taxpayers from
what's
every
that?
state pay
I got you.
for it.
You
No,
use
it's
the
not a
word
gotcha.
our.
What do
Our,
mean
you know
by
what
it?
our means? United States of America. That's what it means. It means
the states.
our. It means the United States of America. And then we take that our and we distribute it to the states.
So why did you
Not
say
that we
it's
have
not
to.
supposed to be state stockpiles that they then
Because we
use?
need it for the government and we need it for the federal government. But
To
when
give
the
to
states are in,
states.
no, to
Then
also
who are you
keep,
giving it to if it's not to the states?
to keep for our country, because the federal government needs it too, not just the states. But out of that, we oftentimes choose, as an example, we have almost 10,000 ventilators, and we are ready to rock with those ventilators. We're going to bring them to various areas of the country that need them. But when he says our, he's talking about our country.
makes
He's
a
talking,
distinction.
excuse me,
And, sir-
he's talking about the federal government. I mean, it's such a basic, simple question, and you try and make it sound so bad. You ought to be,
I'm
you ought to
just
be
trying to
ashamed of
understand.
yourself.
No,
You know what? You ought to
by
be
the
ashamed.
way, Secretary
It's such a
Azar-
simple question. He said our, and our means for the country, and our means for the states because the states are a part of the country. Don't make it sound bad. Don't make it sound bad. Go ahead, Steve. Go ahead, back
The
here.
HHS even changed the
You just
language
asked your
on the
question.
website.
You just asked your question in a very nasty tone.
It was nasty.
Let's go.
You didn't give me an answer.
Please.
Mr. President,
I gave you a perfect answer. You know it. Go ahead.
well, just to follow up on that, when we have the federal stockpile, I mean, isn't that designed to be able to distribute to the states?
Sure,
if
but
they
it's
need it?
also needed for the federal government. We have a federal stockpile, and they have state stockpiles. And frankly, many of the states were totally unprepared for this. So we had to go into the federal stockpile. But we're not an ordering clerk. They have to have for themselves. Now, some of the states were in good shape. Some of the states were not in good shape. That's probably something you could expect.
This was going to go away. It's April.
It is going to go away.
Mr. President,
It
you
is going
said
to
it
go
was going to go away in April. You said
I
when it
didn't say
warmed up in
date.
April.
I said it's going away, and it is going away. Okay.
But
Okay, that's a good answer to your question. No more. That was a long but a very good answer. That was enough for you.
Insurance coverage.
One specifically on New York and the question of ventilators. Governor Cuomo is saying that New York may be days away from running out of ventilators. Can you assure New York that going into next week that they're going to have the ventilators that they're going to need?
No, they should have had more ventilators at the time. They should have had more ventilators. They were totally underserviced. We're doing our best for New York. You know, we have states. We have a lot of states. We have territories too, but we have a lot of states that have to be taken care of, some much more so than others. We've worked very well with the governor. We happen to think that he's well served with ventilators. We're going to find out. But we have other states to take care of. We have a big problem in Louisiana. We have a big problem in Michigan. We have a big problem in 7 other really strong hotspots. But we're doing the best we can. I wish they did the original orders 3 years ago. They would have had all the ventilators they needed, although even then they wouldn't, because if you look at what the original request was from New York, it was far greater than anybody ever heard. And we've supplied a lot. I told you, we supplied some just today to New York, and we supplied some yesterday to New York City. Did you have one in the back? Yeah, please.
If I could say, this is why the question of the stockpile was asked earlier is so important.
I don't think that was the question.
No, it was a very important question because what Jared Kushner said yesterday is that the federal stockpile is for use by the federal government, not for the states to have access to. So you seem to be saying different. So did Jared Kushner misspeak yesterday?
No, he
is
didn't.
that federal
He didn't misspeak.
stockpile?
He used the word
available to the
our.
states?
Okay, our. Our is referring
not
to
for
our
the
country.
states to you.
The states, to the best of my knowledge and to the best of your knowledge, are a part of our country. We are taking what is in the federal stockpile and we are helping states all over the country. But we also want to keep some because when that surge comes, when you hit those peaks, we're going to need, we have to be able to have the flexibility to take those ventilators and bring them to Louisiana, New York, Detroit, different places. That's all.
You will be using
But
them
the
for the
word,
states that
oh, of
need them.
course, we're not using them anywhere else. We're not going to be using them, John, anywhere else. But we want the flexibility because, you know, we don't even know when the surge is coming, but it's coming soon and it's going to be big. And some areas won't have it. Some areas will be pleasantly surprised, just like we've been. You look at the chart. States that I thought would have been maybe a disaster turned out to be really, they've done a great job. Some states are really trouble. But you don't know. You don't know. We have great flexibility. I would have preferred giving them all out. We'd have nothing. And now when we have a surge, we can't get them back from where we gave them because it's very tough to take them back. So we have tremendous flexibility. And it could be New York. It could be Louisiana. Those are 2 that are really rough. New Jersey is very rough. And they've done a very good job in New Jersey, but New Jersey is very rough. Go ahead, please, Nabet.
Yes, the question is about the CDC guidelines. I know that they changed over time from February, and there's
The guidelines relative to which? The
for
masks?
instance, social distancing and the number of people who can gather in a group and so on. And now we have this measure about wearing masks. And I know you told Steve about why you don't want to wear a mask, but I'm just wondering if you can tell us more about why, because it would
I
set
just don't choose to.
an example.
They're not mandatory guidelines. They're guidelines. They suggest you could wear them. You don't have to wear them. In fact, the director is here. If you want to say a couple of words about it, you can if you want. You don't have to.
And your decision. not
But
to-
basically, it's a voluntary thing. Say it, director. Doing a good job.
Thank you very much. I think I just want to reemphasize, I've said this before, that we're not defenseless against this virus. We have a powerful tool, a powerful weapon, that is social distancing. And we've continued to embrace that with the President's initiative to slow the spread of coronavirus. We're constantly looking at new data, and as the Surgeon General said, one of the new information that became more clear to all of us is there's a greater number of people that are asymptomatically infected than we previously thought. And as Ambassador Birx said, that may be inversely related to age. And so really the purpose here is first and foremost to embrace the social distancing. That's the number one thing. That's the powerful weapon. And you know, this virus has a great weakness. It can't jump from one person to another if it's got to swim more than 6 feet. And this is why we really want that. That said, we now know that there may be individuals in areas of significant community transmission that may be asymptomatically infected. And we know that a face barrier can actually interrupt the number of virus particles that can go from one person to the other. So as was said by the Vice President, the President, the purpose of this face covering is to be another adjunctive mitigation strategy to protect someone from spreading the virus from themselves to someone else.
And I was just tested also, so I assume I don't have the virus, so I don't have to worry about spreading it. Okay? Please, go ahead.
Mr. President, I want to make sure we're clear. When you mentioned tariffs earlier
Yeah.
that came up in the meeting, are you considering tariffs on Saudi Arabian oil? And
Well, I
then
can always
also,
consider, look, tariffs have made a tremendous amount of money for our country. I put them on China, I put them on other places, and other countries tariff us, and they take advantage of us, and they have for many years. Look, countries have taken advantage of the United States for years. They've ripped us off like nobody can even believe, whether it be on manufacturing, whether it be on exporting, whether it be on almost anything, including military, where we provide virtually free military assistance to countries that, frankly, take advantage of us, don't even like us, okay? So this has been going on for years. They tariff us. They create artificial, you could say non-financial barriers, which are worse than financial barriers. You can't sell your product. You can't take care of our farmers. They won't take and yet they'll take us and sell into us. And we won't charge them anything for doing it. Look, they've taken advantage of us for years. Tariffs are a way of evening the score. Tariffs are a way of just neutralizing. They have tariffs on us, and we now can put tariffs on them. Am I using it for oil? It's something we can. No. Am I doing it now? No. Am I thinking about imposing it as of this moment? No. But if we're not treated fairly, it's certainly a tool in the toolbox.
and what about with Russia? Would you consider maybe lifting sanctions or giving some sanctions
Well, it
relief?
would be
if
the
they-
same thing. No, it would be the same thing. They are having a dispute, the two countries, and it's hurting the rest of the world because it's really hurting the energy industry. Russia is being hurt unbelievably badly, and Saudi Arabia is being hurt unbelievably badly because oil and gas is a primary, that's where they get most of their income. And this is a price like from the 1950s. All right? It's a price from the 1950s. They are being hurt very badly. I think they're going to settle their dispute pretty quickly.
Why, on the oil, why do
Go
you
ahead,
think you haven't been
please.
Mr. President,
successful in getting them to raise the price? Why do you think you haven't been more successful in getting them to increase production in Russia and Saudi Arabia?
Well, they have increased production. That's what they've done. They've increased it so much that there's, so you meant the opposite.
Why do you think you haven't been successful in getting them to reduce?
Well, they're going to stop because the market, ultimately the market is going to get them to stop. But they both did the opposite. They increased production to a level that water is right now more valuable than oil. Who would have ever thought, right? You go to some of these kingdoms, water is far more valuable than oil. There's so much oil. It's a tribute in a way. But what happened is there was a lot to start off with, and then you had the virus, and it knocked the hell out of the market in terms of demand. So there's no demand, and there's tremendous supply. So, I mean, you saw numbers where it was down to 20 and down, frankly, below 20. It was even below 20. It's an incredible thing, the market. But ultimately, the marketplace will take care of it. But I think they're going to work out their problem fairly quickly. Okay, go ahead.
Mr. President, thank you, Mr. President. We're already talking about phase 4 of a stimulus, right? But you and Pelosi and McConnell are already talking about different things that should be in it. Now, last time, people were telling me that the fact that you wouldn't talk to Pelosi was an impediment and it really slowed things down. Are you
I'd talk. If it were important to talk to her, I'd talk to her. If it were important for the American people, I'd talk to her. But other than that, I can have other people talking to her. Look, you ready? Infrastructure is a great thing for me. I think infrastructure for this country, we have an old broken infrastructure. 50 years ago, we were the envy of the world. And then we spent all this money so stupidly in the Middle East. We spent, it's going to be very close to $8 trillion in the Middle East. How stupid was that decision? But they spent it on that and other things. We've got to fix our infrastructure. That means roads, highways, tunnels, airports, everything. We got to fix our infrastructure. And the beauty is because of the fact that we are so strong as a country, we're borrowing at zero. We never had a chance to borrow at zero. Even this country, we never had a chance to borrow at zero. We're going to borrow. This is a great time. so we can fix our infrastructure and we'll have almost no interest costs. This is the time to do it. Steve, one more question.
The death toll projections that you shared with us earlier this week, are we still on the current trajectory for that, or have social...
Which one? I have many trajectories for many things.
100 to 240,000. Are we still on that trajectory, or have we made any improvements, or maybe not enough time has passed?
Say it, Steve. What?
Have we made enough improvements?
On what? On what?
On social
The models we
distancing.
talked about.
On the
You
models?
said 100,000.
I'd have to ask Dr. Fauci, and I'd have to ask Deborah. Have the models changed?
So a lot of the projections you can see are based on, there's many different ways to look at this. And as we discussed on Sunday, some of it is based on the current global experience. We're about, I think, 6.5 or 5.5 times the size of Italy, a different factor in Spain. And we look at all of those, what their projections are, where they are currently, and where that is going. And so a lot of the work is based on how this virus has moved through other populations. That's a very direct way to see how the virus is impacting a population. There's also terrific models. And so every day and every night, one of the models that actually looks at the model related to mortality is the healthdata.org data. And they update it every night, and you can see where we are in that projection. I think in the last run of that model, they were at 93,000 or something in the model. Now, all of that can be changed by our behaviors. And so, and all of it can be changed in a different way if we don't follow those behaviors. If another major metropolitan area ends up having an epidemic like the New York metro area, that could dramatically change not the model, but the reality of the impact of this virus on Americans.
Now, by the way, the models show hundreds of thousands of people are going to die. You know what I want to do? I want to come way under the models. The professionals did the models. I was never involved in a model, but at least this kind of a model. But you know what? Hundreds of thousands of people, they say, I want much less than that. I want none, but it's too late for that. But I want very few people relative to what the models are saying. Those are projections. I hope they're wrong. I hope we're going to be under those projections.
Two questions on continuity of government.
How come you always have two? Why can't you have one?
Well, they're related.
Every time. I have three questions. I have two questions. Can you give me one instead? Because you have a couple of other people. Go ahead.
Okay, I'll go with my second